and Christina has had some stuff done. But anyways, but she's concerned about certain areas. She's concerned about her forehead wrinkles. Can you make a frown? That, and she's concerned about her cheek line. Can you just tell our viewers what your other concerns are?
Yeah, so always this area is really strong for me. So I like I don't like to have that angry look on those 11 lines. So I like that to be smooth. I feel like I have a little volume loss more so on this side of the face. I want a little bit more of an apple on my cheek, and I want it rounded a little bit more there. And then, of course, maybe a little bit of fullness in the lips. And then I have a little line right here that bothers me at the corner of my mouth that I would like to go away. So.
Very good. So let's talk a little bit about the meaning of all these things that she's saying. As we age, we lose a lot of volume in certain areas, especially around the cheek areas, and especially around the mouth and under the eyes. That's why some people have like dark circles. They've lost volume there, and that's
even here,
and even yes, around the temple. And this is one of the reasons we use certain things that we use. So what are the differences between Botox and fillers? So I use Botox because that's, what everybody knows is very popular. That was the first neurotoxin that we had. But now we have different types. We have Dysport, we have, what's the one that you have? Xeomin. We have Jeuveau, which is the latest one that we have. So there are different neurotoxins. And I call them neuromodulators. Why? Because I can use it to actually shape your face, shape the face of anybody. We also use these toxins to do other things that are medically necessary, like when you have excessive sweating, when you have migraines, for headaches. So we use this for a lot of things. We even use it for spasm, people that have spasm. So it's really medically indicated. It's FDA approved for migraine headaches, just so you know. It's FDA approved for people that have excessive underarm sweating. So that's what Botox and neurotoxins are used for. Now, the neurotoxins are used for fine lines and wrinkles. So dynamic wrinkles, not when the wrinkles are already static, like her wrinkles. Can you make it frown again? So it's dynamic, meaning it moves. But when you have those 11s that are like static, it's going to be difficult. It's going to take several treatments to get that smoothened out. Also, if you have those static lines in the midline, we use fillers. That's where fillers now come in. So what are fillers? We have different types of fillers. We have Juvederm, which is one of the most popular ones that we have. We have Bellafill, we have Restylane, we have Radiance. So what are the differences between these fillers? The fillers are some of the fillers are used in certain areas. Take for instance, what I'm going to be using today will be Radiance, which is calcium based. So I use it around the cheeks. Now she says she's kind of concerned about the fullness. She's lost volume here, as you can see. So we're going to use it to kind of contour and give a little bit of fullness around the cheek area. I can't use the Radiance because it's calcium based. It's a little bit, I can't use it around the lips, but I can use it anywhere that I want to create volume and I want to kind of make it more defined, especially around the jawlines. So that is the filler that I will use for her today. Now for her lips, because she wants a little bit of fullness around her lips, I'm going to be using Restylane Kiss, which is a hyaluronic acid. It's a hyaluronic acid. It's very, very soft, and it gives you that nice volume without, giving you a docked up lip, which we don't do around here, by the way. And like I said, feel free to call us. Phone number is 250-1444. Very good. Or you can also send us a text, and we're going to be answering any questions that you may have. So let's start with you. Are you excited?
I am excited.
Do you have any questions for me before I start?
I guess normal questions that most people would ask. First of all, most people are going to ask, "Does it hurt?" Um, and in my experience, it really doesn't. You have some numbing cream on your face, and then you might feel a little bit of a tugging sensation here and there. But as far as pain, you don't necessarily feel any pain. And then, of course, how should I take care of my face afterwards? Like, what is the aftercare? What should I do? What should I not do? For how long? What are some things that can help me if I have some bruising? Should I use ice if I have a little bit of swelling? So those are normal questions that I would have, that most people would have.
Okay. So I'm going to answer the question. So as far as toxins are concerned, like Botox, so I'm going to treat her forehead wrinkles with the Botox first. It doesn't really hurt. We don't need numbing cream. It takes me about 2 minutes to do. I'm kidding. It takes me about 10 to 15 minutes to perform. But anyways, it doesn't really hurt. One of the things that we do, post-care is we tell the clients do not lay down for 4 hours, and don't rub the area that I treat, especially the forehead, because I don't want the toxin to go to any muscle that I do not want.
No.
I think we have a question here. Make your comment. Okay.
So, Dr. Mara, if I wanted to have a facial after I had this done, how long should I wait before I do that?
I would say in about a week or two, but you cannot get a facial immediately after we do the procedure. So let's do this real quick, and then we kind of go from here. I'm going to come to the other side. And of course, we are going to clean the area with alcohol. All right. And so make a frown face for us. Okay, cool. And so we inject this Botox in certain areas of the face and into certain muscle group. Make a frown again. Okay, so we want to make sure that we inject it correctly. Make a frown again. Okay. Good. Okay. I'm sorry. How does it feel?
Yeah, just a tiny little stick, not anything painful at all. Very quick.
Very quick. And that's it for the forehead lines. And like I said, anybody can get this treatment. There's no point having this 11s just static on your face. That's one of the anti-aging #1 procedure to go to in the world. Okay, and celebrities are not the only ones that get it. Anybody can get it. The cost of this is anywhere from 200 to 500, depending on what you're getting and areas that you're being treated. Now, so I'm just treating this area, and if I want to give a brow lift, I can. I can put a little bit of Botox right here and right there, and we'll give a brow lift, and that kind of opens up the eye area. I can also flip her lip and just put a little bit right there and make her lip just go up a little bit. The crow's feet. Okay, so those are the areas that show aging. And who really wants to? I mean, aging is inevitable. We know that, but you can still age gracefully and more beautiful. So maybe we can just do a little bit lip injection with a filler. So like I said, we're going to use the filler, the hyaluronic acid, and it's Restylane Kiss. And we're just going to do that. And I know people get a little bit cold feet when we talk about fillers. Why? Because we see, some of the movie stars, some of the celebrities, some of the housewives, and their lips are like what you see. You see the lips first before you see the person's face. That doesn't have to be done. So that being said, we're gonna just do a little bit of injection in the lip. Any questions? Okay. So with the lip injection with the fillers, which we use a little bit of a larger needle, but of course she's already numbing. She has numbed for about 30 minutes, so that's okay. Now we can do the injection.
We have a question.
Okay.
but it's not pertaining to directly to what we're doing right now. But I could kind of elaborate on that.
Okay,
for
go
them.
ahead and
Okay.
elaborate.
Is Noxzema good for the skin? Okay, so the thing about Noxzema is I don't know if many people are familiar with it, but Noxzema was first made for people to experience eczema, hence the name Noxzema. It's actually like no eczema, Noxzema. But so it's good to put on the face. I don't find that there's any problem with it at all. Maybe not for someone with extremely oily skin because it is really cream based. But definitely, if you've got some dry skin or some irritated areas on the skin, I don't see any reason why you couldn't use it. However, if you came in and had a skin consultation, we could probably recommend some better products for you.
Exactly.
Because it is really cream based.
Okay. By the way, Christina is a licensed esthetician, our lead esthetician here, so that's why she can answer any of the skincare questions. And by the way, I also recommend hydrofacial. That was the live stream we did last week. Okay, so let's do this. Okay, so talk a little bit about. Okay. So you can just watch it, and we're going to. Alright, this is gonna be fine. Okay. Okay, so just a little bit of flip right there. Like I said, I use very, very small needle. That way you don't feel it like that. And you said you wanted a little bit of volume.
Yeah, just kind of like the pout. I've had a little bit of filler before, and I feel like the outsides have a good amount of fullness, and sometimes I feel like maybe just a little bit of a in the pout of the lip.
Okay. So we're gonna just give you a little pat right there. 1, 2, 3. You're doing great. Cool. Can you tell the difference between this side and that side? So she's had fillers before in her lip, but it still looks like her lip, right?
Mm-hmm.
That's amazing. Okay. Can you tell the difference? That's good. Okay. You're right. How are we doing so far? Can we show her a mirror? Okay. So I have to do this right, or else she might quit on me.
Yeah.
Mhm. And then you were concerned about this a little bit.
Yeah, this right here, there's like a static line that just has developed because over time my mouth has become a little more downward turn. And so that really bothers me. I'm sure with most people, I'm sure you see yourself every day, so you know more about what concerns you in your skin that other people might not see. So you'll start to notice the tiny little things that bother you that maybe nobody else would notice, but you notice it. So
Okay. So like I can tell, I see that right there. And that also depends on how you sleep. If you sleep on a particular side, you tend to have more wrinkles on that side. So let's take care of this. You owe me one. Awesome. So line all gone.
yay! Oh, it's amazing. Absolutely amazing. I better stop looking in this mirror. I'm going to find all kinds of things.
Okay, so what are the frequently asked questions that we can address while we're at this?
Are there any side effects to facial fillers?
Okay, so that's a very good question. Like I said, different kinds of fillers, and we use them differently. The most popular ones are the Juvederm and the Restylane, and those are hyaluronic acid. Hyaluronic acid, they're just like sugar based. They're produced in the skin. There hasn't been any non-side effect, unless you are allergic to lidocaine, which is in the filler. But as far as that is concerned, well, we haven't really seen any side effects so far. The other thing of concern will be bruising, depending on if that person bruises a lot or easily, then yes.
What? It sparked a question. What sort of things can I do prior to my filler to decrease my chance of bruising?
Okay, so um, if you're taking aspirin, non-steroidal anti-inflammatory like Motrin, aspirin, things like that, that can cause increased bruising. I'm not gonna tell you not to drink wine, but it has. If you drink wine, we tend to see people bruise more when that happens. But that doesn't. I'm not telling you not to do that. The other thing is there's something called Anika, which is a supplement that you can get anywhere. You can get it at CVS, Kroger. You can take that before your facial filler. And then afterwards, I will advise that you ice it really good. Ice is the key. Ice is the key. Okay? But other than that, that that's just it. So as far as the calcium base, which is what we're going to be using the radius, is just calcium in a gel. And I haven't seen any. I've been doing this for over 12 years and I haven't seen any side effects whatsoever. The other one is the collagen base, which is the Bellafill. It's longer lasting. I like it a lot because it stimulates your bone collagen. The radius, what I'm going to be using today, also stimulates your own collagen. So um, I think that is good. The collagen base, I have to do a skin test before I inject it on anybody. And I think we have another question. How often is that procedure done with Botox? Okay. So Botox, thank you for your question. Thank you for your question. Botox is done every 3 to 4 months, and it lasts about 3 to 4 months. But if you keep getting it, religiously, it lasts you even longer, and I don't have to use a lot of units to do it, if that answers your question. And how often, there's another question, do you have a full cleansing regimen plan? Okay, Christina is going to answer that.
Yes. So, what I would recommend for a full cleansing regimen or plan, if you're currently not really doing anything and you want to begin, I usually at least am going to recommend an appropriate cleanser for your skin type, an exfoliant, definitely a moisturizer, and a sunblock. That is like the baseline basic skincare regimen that you could use. And I would recommend you do everything twice a day, apart from the exfoliant, which you only need to do maybe 2 or 3 times a week, depending upon if your skin's more dry or more oily.
Okay. So there's another question. I constantly try to keep my skin moist, but it's constantly dry. It constantly dries out. Okay, how do I prevent this? Okay, so number one, I would like to see you to have a face-to-face consultation, because I need to know what is dry to you might not really be dry, and that might be because you're using very aggressive regimen. So um, hyaluronic acid is number one. I love it. I love it. I love it. Hyaluronic acid, and don't just get any. You have to go to um, a licensed provider to get a hyaluronic acid because it's very hydrating to the skin. Now, the other recommendation I'll make is to get a hydrofacial every now and then, because what it does is not only does it take care of the dead skin, exfoliates it, it now infuses moisture into your skin and makes it plumper, and makes it more radiant. So cleanse your skin with a gentle cleanser. Okay, vitamin C is very good because it's a good antioxidant to the skin, hyaluronic acid, and of course a sunblock. Okay, and thank you for your question. That's a very good question. Okay, so now, viewers, discretion is advised.
I have a question.
Yes.
When using the Botox, I know there's a syringe that you use that. Is there any medical, like people who have medical illness, is there anything that they need to be concerned about, or it doesn't matter?
It doesn't really matter, so that's why you have to go to a licensed physician, a licensed provider to do this. Because I have to take your medical history. If you're on blood thinner, there's a risk of bruising, but other than that, you're good. Unless you have a heart condition and you're allergic to lidocaine for some reason, then I'll know what filler to use. So you don't just go to anybody that say they inject. They call them injectors. You have to go to a licensed physician that knows what they're doing. Okay. All right. So let's do this. Okay. So, do you have any question?
Now it's the question that I was. Okay. The question the question that I had. Hi everybody, this is Cornelia. Pertaining to what you just said as far as the procedure for getting Botox. So you just can't come in and say, okay, I want Botox because I want to get rid of my wrinkles, or I want some Resolene to get rid of my 11. There is a process that you have to go through in order for that to be done. So just wanted to make sure, that part is cleared up. Okay.
All right. So we are now injecting. So like some people use needles to inject. I use a cannula. So that's why I say viewer's discretion is advised. So we're gonna give her a little bit of fullness around here, and we're gonna do it right here. So okay. Okay.
That hurt, Christina?
No, it doesn't hurt. It just has there's an
Just a
odd
pressure?
sensation. It's a pressure. You can feel the cannula there, but you don't feel pain from it.
Okay.
Can you tell?
Oh wow, yes.
Mm-hmm. Yeah.
Oh, so quite different from the other cheek.
Yeah, and we're gonna continue. Okay, so there's a little bit of swelling. That's okay. And then we're gonna massage it and massage it, and I can use this. Filler around the jawline to create a nice crisp jawline. I think there's another question here. How can you do that?
How can our company here, Geico, do a group session with you, and who do we call?
Oh, thank you so much for that. You can call us. It's area code 478-333-2595 and ask for Zitira. Zitira is the office manager. She's something, but we love her. Anyways, so you can do that, and we do group sessions. So call her and ask for her, and whatever you need, I will be happy to have a group one with you. Okay, so 2 minutes 2 minutes remaining. So you like that? So that's nice. There's a little bit of swelling right there.
How long will the swelling last?
Maybe a day. And that's what I always tell everybody: eyes, eyes, and eyes.
Mm-hmm.
So like I said, anybody can get this. People that have lost volume around the eyes, around the cheeks, around the jawline. You can use this filler in all those areas. Also, we use it around the temple because those are the areas that show signs of aging. And as we age, we lose volume. And also, if we've lost weight, okay, we lose fat, we lose bone tissue, we lose collagen, we lose elastin. We can put this all back and rejuvenate your whole face. Or we can sculpt your whole face, depending on what your needs are. So why age not gracefully? Okay, let's see. Okay, that's good. Okay. So, like I said, thank you all for listening, and give us a call. Our phone number is area code 478-333-2595. And we'll see you next week.
Next Thursday.
Next Thursday at 10 o'clock. And thank you all for joining. Again, 333-2595. And we're located in Warner Robins, 320 Maggie Drive, and in Macon, 112 Upright Landing. Call and schedule
The
your
views expressed on this program are not necessarily the views of the Glory 980 AM, the Glory Media Group, LLC, WDDO.